A list of common but largely unheard of conditions. Myself at one time or other suffered from many, but the irrelevant ones can add to feelings of well-being. Acute stress disorder. A disorder characterized by the development of symptoms such as severe anxiety, a decrease in emotional responsiveness, and difficulty concentrating after exposure to an extreme traumatic event, e.g., witnessing a death or serious accident. The behavioral disruption must last for a minimum of 2 days and a maximum of 1 month, and must occur within a month of the traumatic event. Adjustment disorder. A disorder characterized by development of strong emotional and behavioral symptoms in response to an upsetting event. Antisocial personality disorder. A personality disorder characterized by a pervasive disregard for and violation of the rights, feelings, and safety of others. It is usually preceded by conduct disorder in children and adolescents and is often marked by a lack of remorse. Anxiety disorders. A group of psychiatric disorders characterized by predominant feelings of anxiety that is either out of proportion or has no discernible cause. Applied behavior analysis. The application of scientific knowledge to reduce problematic behavior by positively influencing people's social actions and interactions. Asperger's disorder. A developmental disorder on the autism spectrum that typically appears first in childhood and is characterized by a person's difficulty in everyday social interactions with others. The most current thinking is that Asperger's is not a separate disorder from autism, but a set of behaviors on the less severe end of the spectrum. Attention Deficit Hyperactivity Disorder, ADHD. A psychiatric syndrome that includes difficulties with attention and organization of behavior. Symptoms may include inattention, distractibility, impulse events, hyperactivity, excessive fidgeting, and poor organizational skills, as well as frustration and irritability when the child or adult cannot meet expected performance standards. For some children and teens, these exasperating behaviors are uncontrollable, persistently plaguing their day-to-day existence and interfering with their ability to form lasting friendships or succeed in school and at home. Autism spectrum disorder. A developmental disorder that appears by age 3 and is variable in expression. It's recognized and diagnosed by the inability to form normal social relationships, by impairment of the ability to communicate, as well as restricted and repetitive thoughts and behaviors. Many individuals also have cognitive impairments. These conditions have been thought of as a set of disorders, but are now being considered one disorder that presents along a spectrum. Avoidance and numbing. Symptoms of post-traumatic stress that include feeling robotic or on automatic pilot, disconnected from feelings and vitality, numbing and avoiding thoughts, places or individuals associated with a stressful or traumatic event, avoidance. Behavioral activation. A form of behavioral therapy that focuses on changing behaviors to address problems. It's used to treat depression and encourages kids to participate in activities they've lost interest in, with the goal of re-energizing positive thoughts. Bipolar disorder. Sometimes called manic-depressive disorder, bipolar disorder is associated with mood swings that range from the lows of depression to the highs of mania. Body dysmorphic disorder. A chronic mental illness in which a person can't stop thinking about a flaw in her appearance, minor or imagined. She intensely obsesses over her appearance and body image, often for hours a day, and impacts her ability to function in daily life. Borderline personality disorder. A mental health disorder generating significant emotional instability that can lead to a variety of other stressful mental and behavioral problems. A person may have a severely distorted self-image and feel worthless and fundamentally flawed. Childhood disintegrative disorder. Also known as Heller's syndrome, this is a very rare condition in which children develop normally until at least 2 years of age, but then demonstrate a severe loss of social, communication, and other skills. It's now considered part of the autism spectrum. Conduct disorder. A disruptive behavior disorder characterized by disregard for other people's rights and feelings. Confused behavior. Behavior characterized by disordered memory and confusion. A person with confused behavior may suddenly have trouble performing easy tasks. Dialectical behavioral therapy. A cognitive behavioral therapy approach that emphasizes techniques for tolerating and accepting distress, as well as what's called mindful awareness, or being aware of one's reactions, as well as those of others, to avoid problematic behavior. Disruptive mood dysregulation disorder, DMDD. a mood disorder characterized by recurrent temper outbursts that are grossly out of proportion in intensity or duration to the situation. Children with DMDD have severe, frequent temper tantrums that interfere with their ability to function at home, in school, or with their friends. Some of these children were previously diagnosed with bipolar disorder. Epigenetics, the study of heritable changes in gene activity which are not caused by changes in DNA. They are often, but not always, in response to the environmental factors. Excoriation skin picking disorder, a disorder where a person picks their skin over and over again, often causing tissue damage and distress, and/or problems with work, social and other daily activities. Executive control functioning, a group of skills that helps people focus on multiple streams of information at the same time and revise plans as necessary. Acquiring these skills is one of the most important tasks of the early childhood years. Exposure and response prevention, a therapy for OCD that exposes a patient to the thoughts, objects and situations that make them anxious, but in a controlled environment so that they decrease their response and reduce compulsions. Exposure therapy, a form of therapy that exposes an OCD patient to the thoughts, objects and situations that make them anxious. Generalized anxiety disorder, an anxiety disorder characterized by feeling unreasonably and persistently worried about everyday things. Internally distracted, an individual cannot focus on the task at hand because he is busy with his own thoughts and actions. Intrusive memories, a flashback or unpleasant memory that interferes with everyday life. Nonverbal learning disorder, children with nonverbal learning disorder appear to have good language skills, but have difficulties solving problems that do not involve written or spoken language. It includes struggles to stay organized in terms of time and space. Panic attack, a sudden intense, overwhelming fear, along with physical symptoms like palpitations, dizziness, and a feeling that one is dying. Panic disorder, recurring panic attacks, and while between episodes, a fear that another panic attack is imminent. Paranoia, a psychotic delusion that others are threatening you or those important to you. Reactive attachment disorder, a rare but serious condition in which infants and young children don't establish healthy bonds with parents or caregivers. Schizoaffective disorder, a mental condition that causes both a loss of contact with reality, psychosis, and mood problems. Somatic symptom disorder, a disorder characterized by a child's intense worry about having an illness. Physical symptoms are real but mild and have been misinterpreted by the child. Systematic desensitization, a type of behavioral therapy that removes the fear response of a phobia by gradually exposing them to the things that trigger those anxieties in a safe environment.